In this video lecture, we'll be discussing professional competence and licensure in the behavioral health care arena. In previous modules, we've talked about various types of competence, and especially decision-making capacity or competence. Professional competence is the ability to perform according to the standards of the profession. It doesn't matter what profession you're pursuing. There will be standards of behavior and performance for any profession. In order to identify what those standards might be, you should consult the ethics code of the specific profession. In behavioral health care, you should consult the ethics code for the specific discipline in which you want to practice. The readings for this module include professional guidelines for the American Psychological Association and the American Counseling Association, and you can see what kinds of standards they offer for their subdisciplines. And indeed, the ACA ethics code specifically states that a counselor should only practice in areas of competence. That admonition, while not included in every ethics code, is really a universal requirement. You should only practice in the areas in which you are competent to practice. Otherwise, you could be found liable for malpractice. So how do we initially gain professional competence? The substantive training that is required varies depending upon the behavioral health discipline. For example, psychiatry is a subdiscipline in medicine. Thus, the educational and training requirements include 4 years of medical school and at least 3 to 4 years of residency training. After such training, psychiatrists can prescribe medication to treat mental health problems, and most psychiatrists are also capable of conducting various types of talk therapy and other treatments. Psychologists have a number of subdisciplines, most of which require a master's or doctoral degree. I've listed 6 subdisciplines here. Clinical and counseling psychologists do assessment and treatment of behavioral health disorders. Forensic psychologists are psychologists who practice within the civil and criminal justice systems. Neuropsychologists work to understand the neurological or physical brain substrates of behavior. Health psychologists tend to focus more on wellness and achieving one's potential rather than diseases and disorders. And finally, school psychologists perform a variety of important functions within the school system in helping students achieve their goals. Mental health counselors are typically master's level clinicians who can do a variety of treatment interventions and even become licensed to practice independently in many states like Florida. Social workers used to just broker services within a facility or hospital, but now they provide many types of treatment interventions and assessments, especially with a master's or doctoral degree. Family therapists, who may have a master's or doctoral level training, work at the systems or family level to help people overcome dysfunctional relationships. Substance abuse counselors work in the addictions field to help individuals with substance abuse problems overcome their addiction. Practitioners in applied behavioral analysis apply behavioral techniques to real-world situations to help people overcome problem behaviors. All of these disciplines try to help individuals who may be in need to overcome personal obstacles and improve their lives. The required exercise for this module asks you to explore disciplines like these in more detail. In many of these disciplines, one could be a generalist who is capable of broadly practicing the profession, or a specialist who has particular skills that can be applied for very complex situations. It's important to know your own areas of competence and skill so that you can best serve the individuals who seek your help. Cultural competence is another important aspect of the broader professional competence. Unfortunately, some people think that cultural competence just means treating people equally, but that's just not the case. Your job as a behavioral health professional is to help individuals having serious difficulties, so you need to be aware and sensitive to cultural issues that can facilitate their recovery. Thus, you need to be culturally competent in order to make sure that you can provide the most effective and relevant care for them. It does not matter what your personal beliefs are. As a professional, the focus should be on the client and his or her needs, and not on you and your beliefs. There are a number of treatments that one could be competent to provide. Treatments could be biomedical, such as medication or surgery, or they could be talk therapy, which is essentially guided discussions and actions to help clients overcome problems themselves. Treatments could be provided in a group where clients interact with each other, including couple or family therapies, or the treatment could be individual, where it is essentially one-on-one with the therapist and client. Talk therapies can be performed using several different types of orientation as well. Cognitive behavioral therapies involve using techniques focused on the way we think about things, or employing operant conditioning techniques to decrease problematic behaviors. Therapists with a psychoanalytic or psychodynamic orientation use theories first put forth by Sigmund Freud in conceptualizing how problems develop. Therapy oftentimes involves discussing early childhood or previous experiences and determining how those experiences are impacting current feelings and behavior. Systemic or family therapy involves looking at systems or networks of relationships. A person's family is often the most critical system to be addressed in this orientation. A humanistic or integrative orientation focuses more on personal growth and cycles of behavior. How a person can achieve goals and grow with experiences can be a central focus. Experiential or constructivist therapies often focus on the here and now. Expression of feelings and role-playing can be important techniques in this orientation. There are many other orientations and techniques as well, including hypnotherapy and art and play therapy. The important thing to keep in mind is that as you learn and implement various types of treatment, you need to constantly assess your own competence to use such techniques and treatments. Again, the focus must be how well your professional skills can assist a client to overcome the problems and challenges facing him or her. It's also important to understand that professional competence is not static. Once you're competent with particular skills, or once you obtain your degree or license, you still need to maintain those skills and competence. Having a degree or license does not guarantee ongoing competence. You need to self-assess yourself on a regular basis and work to improve your skills. Training and continuing education, or CEs, are essential, and many licensing boards require CEs. You can obtain continuing education from professional organizations such as APA, or you may be able to obtain it from an employer or your clinical site. In addition to constantly maintaining your skills and competence, you should also watch for triggers of incompetence or decline. Any professional, and particularly behavioral health care professionals, can experience burnout, impairment, or progressive decline. Burnout is a situation where, as a professional, you're just overwhelmed and tired of providing services. Persons suffering from burnout may not care about the quality of their work, or even the details of what they should do as a professional. The person who recognizes that he or she is experiencing burnout should seek help to overcome it, and most importantly, to avoid letting it impact his or her clients. Behavioral health care professionals can also be impaired. Just because they are professionals doesn't mean they can't suffer from the same things their clients experience, such as mental illness, stress, or substance abuse. Just as with burnout, they should seek help and work to avoid letting it impact their clients. Finally, behavioral health professionals could experience physical and/or mental decline, such as Alzheimer's disease, that can impact the quality of care and services they provide. Again, it is incumbent upon the professional to constantly assess their own abilities and to work to make sure any personal problems do not adversely impact their clients. So how do you decide or determine if you're competent? If you do not feel competent to work with or treat a client, you either need to refer the person to another competent professional or you need to get competence. You can get competence either by receiving additional training, or you could seek close supervision by someone who already has competence in the particular area or technique that you're using. Or if the new technique you're trying to use is very similar to something else you have done, you may be able to implement it slowly yourself. The key is to constantly assess your own competence and your own skills as you try to help your clients overcome their own challenges. There are a variety of ways to assess your competence. You can discuss things with colleagues to have them give you feedback. You could do a self-assessment or review. Or you could do a more formal assessment and evaluation. There are a number of certification organizations that can formally assess the professional's competence. Examples include the American Board of Professional Psychology or the American Board of Forensic Psychology. There are also a variety of ways to improve one's professional competence after graduate training. These include working with others who have more experience and perhaps being supervised by them, obtaining more formal training either through workshops or conferences, or more institutional-based training at a university or clinical facility. Or you could even do a formal internship where the entire program is designed to train you in a specific technique or discipline over a period of time, such as a year or 2 years. If you don't feel capable of treating or working with the client, or if you just feel the fit with the client is not optimal, you may need to refer or transfer that client to another competent professional. When you as the clinician have decided to terminate your work with the client and the client still needs clinical help, that is, you're not ending it because the treatment is no longer needed, you need to do several things to avoid being accused of abandonment. First, you need to clearly and unambiguously inform the client that you are terminating the treatment with them or transferring them to another competent professional. The client needs to know that your relationship with them is going to end, and that they shouldn't be showing up to your office or clinic in the future and be surprised that you will not see them. Second, you need to make reasonable efforts to help the client obtain appropriate continuing care and help them in that transition. Again, the focus should be on the care of the client, and you need to make sure that the client is in good hands. Finally, you need to cooperate with the new treating professional to ensure continuity of care for a client. Once your client has formally authorized you to share information with the new clinician, this cooperation may include speaking with the new treating professional or even sending copies of the client's records. Again, the bottom line is that the focus needs to be on the client's needs, and you must avoid abandonment, or else you could be subject to a malpractice action. Obtaining a professional license from a state's Office of Professional Affairs can enable a professional to independently practice. Licenses typically require at least a master's or doctoral degree. Now, what the license does is assure that the professional has a minimum level of understanding of the field. It is typically a paper test or a computer-based test, and once a person passes it, and they typically require 70 to 80% correct to pass, anyone seeking their assistance can assume that the professional has an adequate understanding of the substantive issues in the discipline. However, it does not mean that the person is competent in the profession, but rather the person has an adequate understanding of the substantive issues. It is still incumbent on the professional to make sure that they are competent with regards to what they are doing. There are over 60 professions in Florida that require a license. They range from engineering to neurology to counseling to barbering and cosmetology. I encourage you to explore Title 32 of the Florida statutes to see what the requirements are for any discipline you might be interested in. The link is provided here and in the reading links page in this module. Looking at the outline of the Clinical Counseling and Psychotherapy Services licensing statute, you can see that this particular chapter governs clinical social workers, marriage and family therapists, and mental health counselors. It identifies how a person can become licensed and how to renew the license. It even discusses sexual misconduct and penalties associated with that. You should note that some ethical issues raised in ethics codes, like sexual contact with clients, are made criminal in licensing statutes. You should be familiar with the licensing statute of any discipline you choose to practice in. So let's discuss some case studies. Here's the first one. Dr. A was trained before courses on cultural diversity were standard fare in graduate training programs. He has attended workshops offered by his state professional association that provided him with information about working with lesbian, gay, bisexual, and transgender or LGBT clients. Dr. A receives frequent referrals from the local university to his private practice, including many clients with LGBT concerns. In addition to attending the workshops, he reads the professional literature in this area and discusses his treatment of LGBT clients in his consultation group with clinicians who are knowledgeable in this area. In contrast, Dr. A has declined referrals of recently arrived Latino clients from the local school system because even though his Spanish language skills are quite strong, he is not fluent, and he has determined that he is not sufficiently familiar with the Latino culture in general and the specific circumstances of recent immigrants to his community. So what are the competence issues here? I would argue that Dr. A is using appropriate care in developing his expertise and expanding his practice to include LGBT clients. He may want to consult guidelines for treatment with LGBT clients from his professional association like APA or ACA, but he seems to be doing the right things. Dr. A also is being appropriately cautious about undertaking treatment of Latino clients given the limitations of his language skills and cultural knowledge. If he wishes to expand his expertise to include Latino clients, he should seek guidance as he clearly has for working with LGBT clients. Here's another case study. Dr. B lives in a rural community and is one of the few psychotherapists within a 100-mile radius. She has begun to receive more referrals of adolescent females who engage in self-harming behaviors such as intentional cutting and burning. In practice for over 20 years, Dr. B is aware that her early psychodynamic training may not be the most effective treatment for achieving behavior change in such individuals, although she believes that the psychodynamic orientation offers a useful underpinning for case formulation. Dr. B attends a weekend workshop that focuses on dialectical behavior therapy and decides to take on several cases of this type. She believes that the training she has received is more than sufficient for her to succeed with these clients. Dr. B is aware of the personal stress related to working with this population, but is confident that she can, quote, handle it. So what are the competence issues here? Dr. B's actions are a bit more concerning. She is assuming that a weekend training makes her competent to implement a fairly complex treatment with a new population for her. And this new population can be particularly challenging for clinicians. Before she takes on such clients independently, she may want to seek out consultation or supervision, or continue to read up in the area, or reduce her caseload because of the stress that can be experienced with these clients. She may want to also actively engage in self-care behaviors that provide an effective counterpoint to her emotionally demanding psychotherapy practice. And finally, and perhaps most importantly, she may want to consult with colleagues to get an objective assessment of her abilities to work with such clients. If something bad were to happen while she is implementing this new approach with a new client population, her competence could be called into question, and she could be liable for significant damages. Here's a final case study. A licensed counselor, Mr. C, has noticed that he has begun to lose interest in his clinical practice. The problems that his clients tell him about are beginning to sound alike, and he feels it hard to stay awake in sessions. Several clients have asked him if he's feeling okay, and recently several have gotten angry when he has briefly nodded off during sessions. Mr. C has found that it has become increasingly difficult to return phone calls to clients and to other professionals. He's noticed that he is not sleeping well at night, his energy is low, and he feels listless. Mr. C has been feeling increasingly overwhelmed by his administrative workload, and he has several custody reports that are months overdue. So what are the competence issues here? It sure looks like Mr. C is either suffering from burnout or perhaps some other kind of impairment. The bottom line is that he should do a serious self-assessment and probably seek professional help or guidance. Consulting colleagues and others who work with him or know his practice would be advisable, and he may need to take a break from his clinical and administrative duties. The focus needs to be on whether he can provide the clients the optimal clinical assistance, and that is seriously in doubt. Be sure to complete the professional competence exercise where you explore a specific behavioral health discipline. You need to complete the exercise form for at least one discipline to receive up to 5 points. But you can also complete the form for up to 2 additional disciplines to receive up to 5 extra credit points each, or a total of 10 extra credit points. Contact me if you have any questions. This concludes the video lecture on professional competence and licensure.